Senator Blumenthal?
Thanks, Mr. Chairman. Thank you for having this hearing. Sorry to be late getting here, but I appreciated our conversation yesterday and enjoyed it. And as I indicated then, I'm really delighted that you're going to be assuming this position. I think we need this kind of leadership, especially from someone who has your experience, 20 years in the Army, and who knows what it is like to be a female veteran. I know that Senator Murray asked you about plans to improve access to care for our female veterans. And Connecticut, for example, has a new facility for them. But how would you assess the current state of care for female veterans around the country?
We have some locations, Senator, who are doing an amazing job taking care of our women veterans. I do think that we need to ensure that that incredible care is across the board. The VA that I entered 10 years ago, which is down the road, and I out-processed at the VA Medical Center, is totally different than the organization that in 2013 than when I went to visit last year and this year. And so I do think cultural competent care across the board. Every facility has a specialist there, but making sure that it's uniform and that our veterans, our women veterans in particular, feel welcomed in each facility that they enter.
We spoke yesterday about the K2 veterans and about the need to expand care for our K2 veterans who worked, as you know, in Uzbekistan at a former Soviet air base, have been exposed to toxic chemicals and potential radiation. Will you commit to working with me to expand care to those veterans and also to secure from the Department of Defense the records that are needed to assess the potential exposure that they have?
Yes, Senator, if confirmed.
Let me ask you about the VA facility in Connecticut. As we discussed yesterday, Secretary McDonough has visited that facility. I hope you will as well. I'm inviting you to come and see it and actually see for yourself the need to rebuild it. It's a 1950s structure, like many across the country, many VA facilities. It has some of the best docs, nurses, staff in the world. They're working with facilities that are out of date, and they are extraordinarily dedicated and expert professionals. But we need the new rebuilding, which is ongoing, new parking garage, new surgery clinic, but the entire facility. So I would suggest that you come see it for yourself. Let me ask you about electronic health record modernization, another topic we discussed. What can be done to make sure that these systems are completed to be interoperable?
Yes, Senator. First and foremost, during the reset, we're going to have to focus on those first 5 sites and make sure that we've listened to our veterans, that we've listened to our clinicians, and that we are able to take those best practices and those concerns and work with Oracle Cerner to make the changes that we need in order to be able to fix the record at those 5 sites. We also need to ensure that the record is scalable so that we can get it deployed to larger sites, including level 1 sites. But we're not going to do anything until it is fully ready to go. We'll work with the firm. I'll work with, if confirmed, also our EHR team and Department of Defense, the JEC, to ensure that we have those changes and that we have the healthcare record our veterans deserve.
Thank you. I want to, again, thank you for your service and thank your family for their support and their service, and look forward to working with you. Thank you for taking this very, very important position. Look forward to working with you. Thank you.
Thank you, Senator.